A person that is considering a Lasik procedure to improve their vision has two major responsibilities: selecting the best surgeon possible for their budget and understanding and keeping up with eye care after the Lasik operation is done. Most Lasik procedures go over smoothly, and more than 90% of the patients are happy with their improved vision and have no permanent side effects. Part of this success is due to a good care at home once the Lasik procedure is complete. The first step in having the best care after a Lasik procedure is to understand exactly what is directed by the Lasik physician. The prospective Lasik patient should be given a good understanding of the entire process when they first visit a Lasik center to interview the physician and the staff. On the day of the procedure, a member of the staff should very carefully go over exactly what steps should be done to encourage optimal eye health and healing after the Lasik operation. One thing that the patient should ask is what side effects are to be expected directly after the Lasik procedure, how long they should last, and which symptoms should be promptly told to the Lasik physician or member of the staff. A number of symptoms, such as fluctuating vision or halos around lights, are to be expected and are not a cause of worry. Ask the staff about any post-operative symptoms that are unclear to make sure that they are thoroughly understood. Each Lasik physician has their own recommended procedures for their patients, but here is a list of typical suggestions that most Lasik centers recommend. First, get some sleep as soon as possible after the Lasik procedure is done. This gives a great boost to the healing process. Second, avoid any contact, bumping, or rubbing of the eyes for at least 5 days after the Lasik procedure. Most Lasik centers have some kind of eye guards to wear at night to prevent patients from rubbing their eyes in their sleep. Third, try to avoid eye strain for some days after the Lasik procedure. It is tempting to try to read all of the signs and words that were previously blurry, but avoid this temptation at least for the large part. If any light sensitivity or glare is noticed, wear dark sunglasses for several days until this problem resolves itself. Some common Lasik side effects are temporary halos around lights, especially when viewed at night, but this is not a problem to be concerned with. It is very important to keep the eyes well lubricated in the days following a Lasik operation. Every Lasik physician will give eye drops to help this, and patients should be specially aware of this before going to sleep. A Lasik procedure may increase eye dryness temporarily, and during sleep, this may make the eyelids stick slightly to the eye. When the patient wakes up, opening the eyelid is equivalent to rubbing the eye. The physician should be notified if this happens, for there are other varieties of eye drops that will solve this problem. Taking these simple steps will give nearly all Lasik patients an easy post-operative experience without any problems. You can find more useful information about how you can cure myopia at www.curemyopia.com now.